wait till Desiree gets back in?
Well, we don't have to.
Oh, okay. Good morning, and thank you so much for joining us here to talk about the COVID-19 Lucas County Public Health and Hospital update. We have several different representatives from each of the area hospitals, in addition to our health commissioner, Dr. Eric Zgodzinski, who will be talking today. Dr. Zgodzinski, I'm going to go ahead and allow you to please provide the introduction and welcome to our guests.
Thank you, Shannon. Appreciate you all being here today. Thank you to the panelists that are going to be talking today as well, too. Extremely important subject. As we see what's happening in other areas of our country, I would expect us to experience something similar, if not the same. So it is now time to really understand what is going to happen in our community, what has happened, and really what we need to do to protect ourselves, our loved ones, our family, and our friends, and especially the community. Several things I want to just update you on this morning are just some basic numbers. Right now, we are very close to getting 50% of our population vaccinated in Lucas County. We're at 49.92%. Again, it is a milestone to be at 50. Of course, we do want to be closer to 70 and above. I mean, that is that magical number. We will progress towards that. We will work towards that. We're going to work towards that from a new initiative that we've started. We are offering a $100 incentive to anybody who is going to be getting their first vaccination for COVID-19. That's going to be at any of the health department's clinics. You will be able to come in, get your vaccination, and leave with a $100 gift certificate, or excuse me, a Kroger's card. that then you could utilize for school supplies, food, other things, whatever you want to do with that. But again, it is an incentive program we wanted to make sure that the community heard about. We're hoping that we're going to see increase in vaccinations because it is truly important for our community, for the state, for the country, and really, if we think about potential variants coming along for the world. So we are a block in stopping COVID, each one of us. Some of the numbers today. Unfortunately, we continue to see a rise. And please remember, from our past waves, we've seen that it's a slow burn to a very fast burn. What do I mean by that? Starting in July, around July 3rd, we only had about 3 cases of COVID that reported to us on a daily basis. As of yesterday, we're averaging more like 60 per day. The running average for the past 14 days is 50. Prior to that was about 14. So again, please understand, we've went through this before. We're experiencing a similar wave as we have in the past. I don't know where this is going to go. I don't think any of the panelists can predict where it's going to go today. I don't know if anybody can truly predict to where it goes. But if we see the trends, of what's happening in other communities, we can project what's going to happen here. Why is it so important to become vaccinated? It's important to become vaccinated because, again, it does stop the transmission of the virus. More importantly, it does stop individuals from presenting to hospitals with severe symptoms and or death. We know that. We've seen that. The research is there. Yes, we can talk about individuals, so-called breakthroughs, who have been vaccinated, who now are transmitting viruses. We know the virus will stop you from getting sick and or passing away. That's important. There are 2 specific things right now that I am concerned with and this community should be concerned with. One, we heard from the governor yesterday. It is our children going back to school. We need kids to be in school. We need them to make sure they are learning. We need them to socialize. Yes, that is so true. But what we are seeing in other parts of the country are significant issues with our children who are becoming ill. And I'm sure our panelists can talk about that today as well too. We've seen it. We could experience it here. So it's important to get vaccinated. Get those kids vaccinated, please. The issue of mask use the governor talked about yesterday. That is a tool that we have. We don't have all of our children vaccinated in our school systems. We understand that. We're asking again for schools to make sure kids are masking up. The other concern that, again, we're going to experience, as we talked about early on in the COVID pandemic, is our hospital systems. They are our lifeblood. They are our saving devices for our lives, our families' lives when they get into an accident, when they present with something, for surgeries that they need, COVID issues. As we've seen in other portions of the United States, hospitals are becoming inundated. ICU wait beds can be 20, 30, 100 deep, somebody waiting for an ICU bed. We're hearing about field hospitals being set up in other states. This is not to dramatize what's happening. These are facts. These are facts that our community could experience. We must protect our hospitals. We must protect our kids. Those are 2 things that I am truly concerned with and that we should all be concerned with at this point in time. I'll have a couple other comments at the end of the presentation today, but I really do want the community to hear from medical professionals, individuals who've experienced COVID and are with us today. Our first speaker, Dr. William Saunders, Chief of Service, the University of Toledo Medical Center. Could you come on up? Thank you, Doctor.
Good morning. I'm Dr. William Saunders, emergency medicine physician and Chief of Emergency Medicine at the University of Toledo Medical Center. After several months of seeing very few COVID cases in the emergency departments, as was mentioned, we are now seeing a lot more. We are seeing a very rapid increase in the number of patients that have COVID symptoms. And unfortunately, we're seeing this population is much younger. The previous wave of COVID affected the older population, Now we're seeing the younger population, which has largely been unvaccinated, at least that we see in the emergency departments. While many don't require a hospitalization, some do, and they're quite sick. Being young helps you, but it doesn't protect you fully. We are able to send some of these patients home, but the ones that we see in the emergency departments are sick enough now to be admitted, and the University of Toledo has quite a few. The Delta variant that we're seeing is twice as infectious as the previous strains, meaning that it's easier for you to spread. It's easier for you to spread to multiple people without you even knowing. Right now, we have a vaccine that helps. It helps you, it helps our community, and it helps our hospital systems deal with this problem. As an emergency room physician and someone who has worked throughout this pandemic, we really encourage you to get this vaccine. It will help you and it will help us.
Thank you, Doctor. Next up is Dr. Cathy Cantor, Chief Medical Officer, Mercy Health Physicians-Toledo. Thank you, Doctor.
Good morning. I'm Cathy Cantor. I'm a pediatrician and Chief Medical Officer of Mercy Health Physician Group. And really, I've come today to talk about the highlight the American Academy of Pediatrics has recommended to safely return our kids back to school for the 21-22 school year. What we do know is there's a large group of our children returning to school ages 12 and under that are not eligible for the vaccine yet. These are the children that we want to make sure we protect, as well as the other children who have not been vaccinated returning to school. With COVID, this is a different variant that we're seeing now. The Delta variant is highly contagious and it's affecting our children more than ever. And it's adding perfect fuel to our kids returning to school as it's coming to Ohio right at the time kids are returning back. So what we're asking, and the American Academy of Pediatrics is asking, is for schools to strongly encourage all kids to mask up, to protect not only the children, but also the teachers and staff. Because what we know with Delta variant, again, it is affecting the United States at a rapid rate. Ohio is one of the last states to be affected, but it's coming, it's here. We're probably a week or two away from seeing the large effects that they're seeing in the South. And again, the timing is right at the time that kids are returning to the classroom. And I have 2 9-year-olds returning to 4th grade hopefully next week, and I more than ever want them returned back to the classroom. But as we know, it really changes their academic environment, but also social and emotional learning and environment that's happening inside schools. So if we don't protect our children with masking up, but also with vaccinations across the community, we may see our kids back at home in virtual learning, which again, it's gonna affect many communities and it's gonna affect their academic achievement, but also social and emotional development. So really, we can't stress enough to the community how important that vaccinations are, but also masking up for all these kids returning to school to make sure we keep them safe, keep them in school, and hopefully keep our healthcare systems with open beds for the sick kids and sick adults coming through with this Delta variant. So really, just I implore you today to make sure you're masking your children up, but also vaccinating those that are eligible. Thank you. Next up, we have Lindsey Chandler, who is our clinical nurse manager with our Mercy Health system.
Good morning. My name is Lindsey Chandler. I'm a clinical nurse manager at Mercy Health, the emergency department, in the ICU. I come to you today from a perspective of someone on the front lines who sees the difference between patients that present who are vaccinated and those who aren't. I get asked a lot by my family, my people in my community, the people on my teams, like, why did I choose to be vaccinated? And when it came time for the vaccine to be, readily available, I signed up immediately. Last year was a time of uncertainty. It was a time of, just so much unknown in the hospital, how things were transmitted. And the thing that was scariest to me was every night when I would go home,
I was always scared. Was I bringing the the COVID virus home to my family? Was I bringing it home to my friends? And we were distancing, but the people in your household, you can only distance so much. And as a nurse, this is my calling. This is what I was meant to do. But I didn't want to bring it home to my family. So I feel like when I go in now to work, I feel like I'm going into battle with my armor on, and I feel like I tell my teams the same thing. When I decided about the vaccine, I spoke with people I trusted, pharmacists and doctors and medical professionals, and I trust the science. And so I really, I encourage the community and the people on my teams to do the same thing. Read the literature, talk to people you trust in the medical community, and get vaccinated. In the emergency room, we're starting to see, this ramping up, as everyone's commented today so far. And our teams are feeling like, are we heading back into a bad season? It's getting to be scary again. We just really want the community to know when you get your vaccine, you're protecting yourself, you're protecting your family, but you're also supporting the medical community and helping us take the burden off of the emergency rooms and the hospitals. So that is all I have today. I am going to turn it over to Dr. Jennifer Hanrahan, Infectious Disease Specialist at ProMedica and the University of Toledo College of Medicine.
Thank you very much. What I would like people to understand is we've heard a lot about the Delta variant being more contagious, that it spreads more easily. But the part that people don't is what actually happens when people get sick and come into the hospital. I have been seeing people since the beginning of this pandemic, and I will tell you that the people that I'm seeing now are much sicker than they were before. And let's just be clear, people were plenty sick at the beginning. This is the worst thing that I've seen as an infectious disease specialist, and I've been doing infectious disease for close to 30 years. So the fact that people are now coming in with much more rapid respiratory failure should be really scary to everyone. And people have this idea that maybe they come in and need some oxygen and are going to go home again. That's not what's happening. People are coming into the hospital, they are progressing quickly to needing a lot of oxygen. And this is different than what we saw at the beginning. The pace of this is quicker than what we saw at the beginning. So more people are progressing to respiratory failure. And then for the people that survive that, there's long-term consequences. And you're going to be hearing shortly from Maynard Porter, who's going to be able to tell you about some of the effects. But one of the things that happens when people have respiratory failure is they get scarring in their lungs and they don't go back to normal. So this is a vaccine preventable illness. I think it's incredibly important for people to understand that they don't have to get that sick. And the thing that people tell me in the hospital is, I wish I would have gotten the vaccine. And they're all sitting there kicking themselves for not having gotten the vaccine and for having to go through all this unnecessary suffering. So I'm encouraging people not to be in that situation, to find out that you should have gotten the vaccine when it's already too late. And the other thing is, if you're not getting the vaccine for yourself, think about the people around you. You don't really want to be responsible for causing someone in your family or someone you love to go through a lot of unnecessary suffering and possibly death. So those are the reasons to get the vaccine. This is a vaccine preventable illness. You don't have to get sick. And I want people to understand this is not like a mild illness. This is very, very serious, and people get extremely sick. And next up is Maynard Porter, who is a patient who has been through an incredible ordeal and is willing to share this with you today.
Good morning, everyone. I've battled COVID since November 30th was when I was first diagnosed. I was in Flower Hospital for 47 days, incubated on a trach, came home, got home care. At that point, I've developed a narrowing and obstruction of my airway. I've had 6 procedures to open my airway and to keep me alive to this day. I'm working with a team out of Cleveland Clinic. I have a reconstructive surgery that is scheduled for September. I implore everyone, get vaccinated, be safe, wear your mask. I love my family. I love all the community that I live in, everybody that could see me and hear my voice. I want everybody to be well. safe. The vaccine is there for us to get. Please get it. Please get it for you, for your loved ones, for the community, for all of us to be safe. Safe. Please get the vaccination. Thank you.
Well, thank you very much. Dr. Paat, Internal Medicine, McLaren, St. Luke's.
Thank you, Eric. Thank you, Mr. Porter, for that powerful story. I'm an internal medicine physician at McLaren St. Luke's Hospital. The first 3 patients that I saw yesterday were either suffering from COVID long hauler symptoms or had COVID themselves. And my wife's cousin is currently on a ventilator fighting for her life with COVID. All of them were unvaccinated, unfortunately. So COVID disproportionately affects the minority population. We've known that for a long time. There are a lot of reasons for that. More of the minority population is in the housing, less access to health care. And unfortunately, in Lucas County, our rates are about 5% lower than the rest of the state. Currently, 37% of the Latino population is vaccinated in Lucas County, and worse yet, for the black population, it's about 30%.